Good day everyone, I am Louie Estrada from MSG Basin 1 and today I am going to perform perineal care. So bathing the genitalia and surrounding region is referred to as perineal care. Professional clinical judgment will be required for proper examination and management of the perineal region. So the purpose of this is to maintain the hygiene and avoid infection in the perineal region. Then, to make him or her feel at ease. Then we have to prepare the necessary equipment and supplies. So this is to avoid being late or wasting as little time as possible. So the equipment to be used are gloves. So here, then we have the washcloth and bath blanket. Here and here. And also, we have the basin with water. So we have here the basin with water. And of course, we have the waterproof bath or the bath pan. So we have it here. Then we have the soap and of course the toilet paper. So we have here the soap and here is the toilet paper. Considerations before, during, and after the procedure. So before the procedure, you must guarantee that all the necessary equipment is available, then maintain a level of privacy. And during the procedure, always remember proper body mechanics to prevent overstretching or body straining and make sure to do so. Then we have to always remember proper positioning techniques for patient's comfort and of course, follow the necessary standard correct procedure in doing so. Then we have after the procedure, which is to document the result. So things to document after the procedure, we have to record the procedure done in performing the perineal care. So then do hand washing or apply alcohol and then don on gloves. So this reduces anxiety and promotes compliance. Then, pull curtain around client's bed or close room door. Then place a bath blanket over the client's abdomen and thighs. So this provides client's privacy during the procedure. So I am going to close the door now and close the windows. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am about to do. So, okay, good morning sir. I am Louie J. Estrada, your student nurse for today. May I see your wristband please?
Yes.
Okay. Please state your complete name.
Cedric M. Estrada.
And your birthday please?
June 10, 2010.
Okay. So now I am going to perform a perineal care. Is it okay with you?
Yes.
Okay. Okay, sir, I am going to place the blanket over your thighs. Then, place the Kelly pad under the client's buttocks. So this step prevents the soiling of the bed linen. Okay, sir, I am going now to place this Kelly pad under your buttocks. Then, place a pail just below the Kelly pad. So this is for the support. Relax. Okay. For females, assist client to a dorsal or recumbent position. So this is the proper positioning when doing a perineal care. Okay, sir, I am going to arrange you in a dorsal recumbent position. Sir, please relax. Then, lower side rails, and help client flex knees and spread legs. So this promotes comfort. Then fold the corner of the bait blanket up between client's legs onto the abdomen. So this is to provide privacy. Then assess the genitalia for signs of inflammation, then the skin breakdown or the infection. So this helps prevent further damage. Okay, ma'am, I am going to check now your genitalia. Okay, there's no sign of inflammation. The skin looks fine, and also there is no infection. Then I am going to wash the external genitalia and upper thighs by pouring sterile water 6 inches away from the area. So this is to clean the cleanest to the dirtiest area of the genitalia. Okay, I'm going now to wash your genitalia, ma'am. Okay. Are you feeling okay, ma'am? Okay. Then I am going to wash the labia majora. So I am going to use the non-dominant hand of mine to gently retract the labia majora with dominant hand. Then I am going to wash it carefully and in between skin folds, and also wiped in the direction from the perineum to the rectum. So meaning from front to back. So this can help to keep the outside of the genitalia healthy. Okay? Just tell me if something is wrong or if you're feeling something. Okay, ma'am? Okay. Thank you. Then I am going to repeat the process on the other side using the separate section of washcloth and cleanse and dry thoroughly. Okay, so this is for further healthy cleaning. Okay, ma'am, I have already dried your private area. Then, I am going to separate the labia using the non-dormant hand. This is to expose the urethral meatus and vaginal orifice. So with dormant hand, I am going to wash the pubic area downward toward to the rectum in one smooth stroke. Then I am going to use the separate section of the cloth for each stroke. Then I am going to cleanse thoroughly the labia minora in order to clean the clitoris and vaginal orifice. So this is to avoid infection and to provide a healthy care. Okay, so I am going now to separate your labia, ma'am, using my non-dormant hand. Okay. Okay, then next the urethral meatus and the vaginal orifice. I am going to wash now. Okay. I am going to use the opposite section. Okay. I am going to wash it again to clean it thoroughly. Okay. So then I am going to use the other washcloth now to clean the area. Okay. I am going now to dry the perineal area thoroughly using the front to back method. Okay, so using just this side can cause contamination and can cause infection. Okay, so I am going to use the front to back method. Okay. Okay, thank you, ma'am. Okay, thank you, ma'am. You may now relax, ma'am. So for males, we are still going to provide the blanket or bath blanket for the patient to protect his private area. So I'm going to position the patient in a supine position with knees flexed and hips slightly externally rotated. So this facilitates access to the perineum, the groin, and the inner thigh. Okay, sir, I'm going to place you in a spine position. Okay. Okay. Externally rotate his legs like that. Okay, sir. Are you feeling okay? Okay. Then fold the half of the bath blanket down below the penis. Wash and dry the patient's upper thigh. So this is to provide privacy. Okay, sir, I'm going to wash the upper thigh. Okay. So I have already finished donning on the gloves. So I'm going now to gently and firmly raise the client's penis. So if the client is uncircumscribed, then I'm going to retract foreskin or the prepubes to expose the glans penis for cleaning. So this promotes compliance and of course to clean thoroughly the glans penis. Okay, sir, I'm going to use my penis. Okay, sir, just relax. Then, I am going to wash the tip of the penis at urethral meatus first. So, using circular motion and cleanse from meatus outward. So then, discard washcloth and repeat with clean cloth until the penis is clean. So, rinse and gently dry thoroughly. So, direction of cleaning moves from area of least contamination to the area of the most contamination, and this preventing the microorganisms from entering the urethra. Okay, now I'm going to wash the tip of the cranius. Okay, at urethral meatus. Okay. going now, sir, to bring your pelvis in a circular motion. Okay. Okay, so now I am going to put this on a spectacle. I'm going to get another one. Okay, I am going to write gently. Okay. Okay, so now I am going to return foreskin to its natural location. So this is extremely important in patients with decreased sensation in their lower extremities. Okay. Okay, so now I am going to wash the shaft of the penis with gentle but firm downward strokes. So I am going to rinse and dry it thoroughly. So vigorous massage of penis may cause an erection, so we have to avoid. Okay, I'm going to put another one on each one. Okay. Are you feeling better, sir? Okay, so now I am going to gently cleanse the scrotum. So I am going to lift carefully and wash underlying skin folds and rinse and dry it. So this is to provide comfort for the patient. I am going to get again the water to clean the scrotum. Okay. I am going to get another washcloth. Okay. Okay, sir, are you feeling okay now? Okay, so now I am going to fold lower corner of that blanket back between client's leg and our perineum. So I am going to ask the client to lower legs and assume to a comfortable position. So this is for patient's comfort. Okay. Okay, sir, please relax. Are you feeling fresh now, sir? Okay, that's good to hear. Please relax your legs, sir. Okay, that's good. Are you feeling more comfortable now, sir?
Yes.
Okay. So then, I am going to remove the calipat and take off gloves and dispose in proper receptacle. Then, I am going to perform hand hygiene. So, this is to prevent contamination and provide infection control. Okay. I'm going to throw it to the receptacle. And of course, I'm going to put alcohol. Then I'm going to apply hand washing. Then I am going to place the client in a comfortable position and cover with a sheet of blanket. So this is for patient's comfort. Okay, I'm going now to remove this and put this on a receptacle. Okay. Yes, sir. Please relax. Okay, so I have already done putting him a blanket. So I am not going to put a blanket now. Then, I am going to document the procedure done and any assessments findings like vaginal discharges and lotria. So, this is for legal purposes and future references. We have to remember that what is not written is not done. Thank you for listening.